We've expanded into gastrointestinal disease. We're interested in Crohn's, we're interested in diverticulitis, and we're interested in gastric cancers. One of the projects that we're working on now is in the Noonan syndrome, which is one of the rhasopathy disorder patients, where too much or too little activity of an enzyme can either lead to severe diarrhea or constipation, which can lead to gastric cancer. So our lab is using CRISPR-Cas technologies to introduce those mutations and correct them to determine if we can rescue the defects and cure those diseases. We hope that we can apply this not only in the rare disease space, but also in more common disorders as well. Finally, our lab is using inducible pluripotent stem cells, which can allow us to study the onset of particular diseases by differentiating those cells into any tissue we're interested in studying. Once we have those stem cells, we can then use a variety of different growth factors to differentiate those cells back into any cell that we're interested in looking at. By doing this, we can actually understand that particular patient's disease in a more formal way. We can develop that particular disease and study it in a tissue culture dish, find ways to treat that disease with therapeutics using high-throughput screening of drugs, and then we can also understand the molecular mechanisms that lead to that disease so we can try to understand it and cure it in many other patients as well.